IHA is Indigenous Allied Health Australia. We're a national peak body. We're member-based for Aboriginal and Torres Strait Islander allied health workforce.
The Indigenous Dentists Association of Australia has been going for 12 years, and our primary purpose is to provide a vehicle for Indigenous dentists and dental students to come together and really to have a connection, to talk to each other and of course share the war stories, so to speak. But it's also got a really important role nationally, working with the other Aboriginal and Torres Strait Islander health organisations, Indigenous doctors, Indigenous Allied Health, Congress of Aboriginal and Torres Strait Islander Nurses and Midwives, NACCHO, all the organisations to put our voice in to make sure that we're building on that collaborative policy development model, but not forgetting that oral health has a particularly important place in overall health.
I chose to be a dentist just because of the lack of Indigenous dentists. For our people, it's very important to have a good smile, at least have the teeth to be able to eat a healthy diet. As we know, there's a strong link between chronic diseases such as diabetes, heart disease, and we even know there's links in preterm and low birth weights in those that are pregnant as well. So it does play a very vital role having very good oral hygiene.
This MOU is critical for Aboriginal health and especially for Aboriginal holistic health.
The MOU between IHA and Indigenous dentists is a great opportunity for us to, as Indigenous dentists, to be part of a bigger group. There's not a lot of Indigenous dentists in the country, and to join with physiotherapists and psychologists, occupational therapists, the entire allied health group, plus also oral health therapists and dental hygienists, gives us a much stronger connection and a better voice.
It's important to grow the allied health workforce, and particularly dentistry, because again, if what we want to do in this country is close the gap and eliminate health inequality, we need to make sure that the workforce is there, and particularly the Indigenous workforce even more important. So ensuring that the next generation of allied health staff and dentists are aware and have a capacity to provide good care to Aboriginal and Torres Strait Islander people is something that we really strongly support.
I think it's very important for Aboriginal and Torres Strait Islander health leaders from all professional groups and community organisations, art shows and other organisations to come together and work out what our consensus is about the various approaches to putting forward to the government about Aboriginal and Torres Strait Islander health and developing policy in a collaborative way.
The work we do at IHA addressing racism is important due to we find there's a lot of institutional racism within allied health workforces and also within the health system. We have developed a cultural responsiveness framework that has been developed to change people's thinking and change people's ideas around racism within the country.
Cultural safety is absolutely critical. We know from the most recent Australian Institute of Health and Welfare report on closing the gap outcomes that over nearly 60% of the gap is not due to socioeconomic status, it's not due to risk factors, it's got to be due to a lack of cultural safety, institutional racism, and of course intergenerational trauma. These are significant factors in delivering poorer outcomes for Aboriginal and Torres Strait Islander people across the country.
So we need more Aboriginal and Torres Strait Islander people everywhere really in the health system, and particularly in frontline jobs like allied health and dentistry. So I think not only because we've got a huge challenge ahead of us still in providing good care in ways that our people will receive it, and you can't get any more culturally appropriate than the care being delivered by Yane Mop.
I hope the MOU between IHA and the Indigenous Dentists Association will help to improve the overall well-being of Aboriginal and Torres Strait Islander people in this country, whether it is oral health or nutrition, but everything as a holistic health.
With Indigenous Allied Health and Indigenous Dentists Association Australia, we'll have a much broader reach with all the work we all do. We'll have a lot more broader scope, and we'll be able to influence policy development. We'll be able to work on submissions, grants together and have more impact for Aboriginal and Torres Strait Islander health.